Jonathan Needham. I'm from here in Myrtle Beach. I'm 61 years old, retired engineer, avid golfer. And it sounded really interesting to me. I had, from years of playing sports, high school, college, etc., I always knew that my knees were in tough shape. I was on a lot of anti-inflammatories. I was on a lot of painkiller, and I could get by, but I was kind of looking for what the next step was going to be. Unfortunately, I didn't want the next step to be knee replacement, and there's not a lot of alternatives out there. So in talking to him and finding out about the stem cell, the regenerative stem cell procedure, it was really interesting to me because it didn't require any surgery, it didn't require replacement, it didn't seem to have any limitations if it worked correctly. So I really signed up for it. He's obviously quite compassionate about the subject. I knew that my knees were, from my age and the amount of sports and injuries and stuff like that, I knew there was an arthritis issue associated with my knees. Certainly, it was easy to tell that range of motion was limited, at least on one knee. And I was fairly sure that cartilage and things like that were worn away significantly, because obviously the long aching kind of pains you get were more of like a bone-on-bone feeling. Well, after I originally talked to Dr. Mike about it, I went back and did a lot of internet research on it. And about who provided the stem cells, the companies that did it, which ones were the FDA approved companies. There's a lot of countries and outside countries that you can get the procedure done in, and it's relatively inexpensive. But once you read on the internet, you realize that where the stem cells are harvested from, how they're controlled, how they're processed is really key to having a healthy procedure. In a lot of these countries, Mexico, Costa Rica, Thailand, they're not very clear about where the stem cells come from, and they're being injected into your body, so I think you have to pay attention to that. So I did a lot of internet research for the most part. You know what, it was less of an event that I had planned for. I had this vision that it was going to be, this big event with giant needles and pain and stabilizing my leg, and honestly, it was kind of a non-event. It really was. The guy that Dr. Mike has come in to do the injections was like fantastic. I mean, he did injections. I wish every injection, I have a fear of needles, so I wish every injection in my life would have been that drama-free, because it was like there was no injection whatsoever. And literally the whole procedure, the actual procedure, if it took 5 minutes, it was a lot, probably. It was very, very quick. And then, you walk out of the office, immediately I noticed I didn't have the achy pain, like the bone-on-bone pain that I had before, which Dr. Mike had said that would happen anyway, because you're injecting, a liquid as a cushion in between the two bones, etc., and in your knee. Day one is a little rough. You get some pain from the injections and stuff like that. Sleeping the first night was a little rough, but come Sunday it was 50% better, and then by Monday I was really walking 1 mile to 2 miles a day with really no pain whatsoever. I would say make sure you do your research, understand what your options are. It's probably not for everybody, but a guy like Dr. Michael does a good job of explaining to you who it will work for and who it won't work for. And I would take it as an alternative. I mean, because you reach a certain point that your alternative is really significant massive surgery, joint replacement, things like that, which have a lot of limitations that people don't realize, especially if you're an active person. But the way I looked at it is, I would do the stem cell therapy. I could always have the joint replacement. That's always could have been a plan B for the future or whatever, but I'm very positive about it. Very.